Hi everyone, my name is Emmanuel Amoakoh. With me today is Dr. Ayeo.
Yes.
And Dr. Ayeo will be giving us some helpful tips on ways and means of managing diabetes. Dr. Ayeo, please over to you.
All right. So I'm basically going to dwell on the dietary modifications that diabetics should go through to help with control of their sugar. Diabetes is a very broad topic to discuss, and it's talking about every aspect of diabetes is beyond the scope of this video. So I'll simply dwell on the dietary modifications. As far as diet is concerned, most diabetics are basically told to avoid sugar and to eat vegetables and fruits. This information is way below optimal for most diabetics, especially for our grandparents, the locals, the poorly educated ones that seem to grasp this information as raw as it is. It makes complying to this advice very difficult. I'm going to talk about a couple of meals that we can dwell on mostly and those that we should avoid. I'm going to give us a couple of examples to make the variety in our meals much more easy and making compliance to the dietary modifications easy. So I'll talk about the complex and simple carbohydrates. In simple terms, the complex carbohydrates are those that are unprocessed. These are whole grain foods or whole foods that have not gone through processing, so their fiber content is maintained. Examples are fiber in fruits and vegetables. So you can talk of bananas, for instance, with regards to fruits. Veggies, you can look at broccoli, lettuce, cabbages. You can also talk about vegetables like carrots. And then with regards to the legumes and the whole grains like beans, you can talk about sorghum, you can talk about corn in its unprocessed form. All these are healthy complex carbohydrates rich in fiber. They provide early satisfaction, so they make consuming a lot of it very difficult. Early satisfaction means the patient eats very little before they get satisfied, so they are not tempted to overeat to sort of try and then meet their hunger pangs at multiple times. This helps in very good sugar control. Besides, the high fiber content of the complex carbohydrates makes digestion much more easy. It improves overall sugar control because of how it affects the way the body secretes the insulin. The simple carbohydrates are the ones that have been processed. Usually when you talk of simple carbohydrates, people assume it is only the processed white sugar or the brown sugar. There is more to it than that. So the drinks you are drinking, the Coke, the Fanta, the Pepsi, whatever carbonated drink it is that's your favorite you are drinking, all these contain simple carbohydrates. They risk putting you through poor glycemic or sugar control. We also have the toffees, the biscuits, the cookies, the cakes that you love so much, your pancakes that you are frying all the time, etc., etc. Even your KFC fries that you love to buy occasionally because you think you are eating it once a week. All these are complex carbohydrates. They go a very long, simple carbohydrates, sorry. They go a very long way to sort of affect your overall sugar control. There are other meals or other food ingredients or products that also go a long way to affect your overall sugar control and risk you having complications as far as your cardiovascular system is concerned. Talking about the matter of fats or lipids, we know very well that ideally we prefer the unsaturated fats compared to the polysaturated fats. So the unsaturated fats, for instance, you'd get them a lot in the plant oils, so like soya oil. You can also get it from sunflower oil, olive oil, compared to the animal-based fat products. An exception to this is the coconut oils and then the palm-derived oils. These are very rich in polysaturated fatty acids. They are unhealthy. They risk a lot of cardiovascular complications as well. As far as proteins are concerned, we want to advocate more for the fish-based proteins, if not possible, because of financial reasons or inaccessibility to frequent fish supply, then we advocate for plant-based proteins. Common examples in our parts of the world are beans and then soya products. We try to advise against animal-based proteins as much as possible, especially those that are very high in fat, like the pork and then the cow. Usually for the chicken, most people will qualify this as lean meat. We prefer that the person is consuming parts of the chicken like the chicken breast, which is lean, very low in fat, but rich in proteins. All right, thank you.
Thank you very much, Dr. Ayeo.
You're welcome.
Just for clearer understanding, that means you are saying, apart from the sugar, which people believe
Yes.
they should avoid. There are other things like even these normal drinks,
Yes.
processed drinks,
Processed drinks.
all this juice and all
Exactly.
that. It needs to be avoided.
Yes.
Okay, but there is something I also want to ask.
Okay.
Is it okay to take honey?
Honey, well, it's more or less like a gray area.
Yeah.
You see, honey is natural.
Yeah.
Most of the time, if the honey is unprocessed, we don't have a problem with it.
Okay.
But most of the honey you see on the market these days, it goes through a lot of processing, and then they will still label it as natural honey or pure honey. So we tend to be very concerned about the supply of the honey for the patient. The patient is guaranteed that their supply of honey is pure. We don't mind them using it occasionally in their breakfast. But if we cannot guarantee the sure proof state of the honey, then it's better the patient doesn't dabble in it. In that case, when your patient has an issue with how to make their breakfast still tasty without adding sugar, usually we advise they use products which we call sweeteners. The sweeteners are usually products on the market that are made to add flavor or some sweet taste to the food without necessarily putting the patient at risk of their sugars going high. So we have the nutritive ones like sorbitol and fructose. These ones we don't advise them taking. The non-nutritive ones, which are the ones that do not risk your sugar going high, a common example is aspartame. These ones are very good, and we advocate that the patient takes more of these.
Okay. Okay. Thank you very much,
You're
Dr.
welcome.
Bertrand Ayeo.
You're welcome.
We are so grateful
You're welcome.
for your time. Thank you very much, viewers. Please, if you watch this video and you find it interesting, please don't forget to like this video and subscribe to my YouTube channel. And also, you can share it with others so that they can benefit from this talk show. Thank you very much once again. Thank you for your time. Bye-bye.